Good evening, everyone. Am I audible and visible? Please comment so I can start with the session. Good evening, Gibson. Hi, Rushi. Okay. So before we start with the session, I'll try to keep it as short as possible. I know you people are not that much interested after cracking your entrance exam about this. So good evening to everyone. I'll be talking about everything. So see, whatever queries you people will be posting in the comment section, I will not be taking up initially because that will dilute the way I'm going to discuss stuff with you. So first of all, अगला 15 minute listen to me, है ना? And after that, I will keep it as an open house session, and whatever queries you people will have, I will try to answer to the best of my capabilities. So some of you already know me, some of you have been my students, and others we are meeting for the first time. So myself, Dr. Sandeep Sharma. So I've done my MBBS from IGMC Shimla almost 2 centuries back, it looks like. And I've done my MD Pediatrics from PGI Chandigarh. So after doing my MD, right now I have a small practice in Chandigarh. Right now, I'm speaking from Chandigarh, and I've been into professional teaching as well. I have been a part of one of the leading institutions in the past, and right now I'm associated with doc tutorials for NEET-PG and for NEET super specialty entrance. I have collaboration with PrepLadder. That is my professional aspects. So why this session? See, first of all, it is going to be an informal session regarding pediatrics alone. Don't worry, there is going to be no marketing, no branding, no institute promotions here. So it will be just me, the pediatrician, discussing, sharing my perspective regarding pediatrics, regarding the branches, regarding DNB, MD, and all these things in a relatively non-biased manner. When I say relatively non-biased, it means, see, end of the day, each human being has his or her own bias. So other than that, I'll try to put forward my point, and afterwards also we can always, have a healthy discussion about the points which I discussed. So what all I will be talking about in this session? I'll be talking about pediatric seats. What were the MD, DNB seats in all categories? The cutoffs which were there, the technical things. What are the top places to do? What to choose if you have a borderline rank where you can get a MD seat in government versus a DNB in a good place. My perspective. And what about diplomas? Points to consider while taking a seat. Pediatrics as a branch, how life is going to be about residency, what are the future prospects. So it will be like a buffet thing for everyone. So everyone will have something to learn from it if you want pediatrics, of course. So afterwards I'll be taking the pediatric queries. So let us, and lastly, before I start, no harsh words for anyone, because see, it's going to be an informal session. No north south, no east west, no politics, no religion, nothing. I may be wrong, I may be right, you may agree, you may not agree. You're most welcome to criticize later on, but right now we'll maintain decorum and start with the session. So let us begin with the session. First of all, I'll be talking about what happened in NEET 2020 last year counseling. So first of all, let me begin with the All India counseling quota. I'll be starting with the general pediatrics. So what to expect based upon what last year happened. This year, you know that there is some. I've made my own analysis based upon the things which have happened in the last few years. There have been some improvement in the seats from what we have heard. At the same time, there has also been some reservation thing which has come into play. So what all you will be getting, whether you will be getting a seat of your choice or not, will depend upon the actual counseling. So first we'll analyze what happened in the last year. So last year, when we talk about MD seats, we are first talking about only MD pediatrics. Round one means the first counseling. The There were total pediatric seats which were available MD through All India quota were 512. In case you want to write also, you can write it down. For those who just want to listen, this entire video will afterwards go as a recorded session, so you can listen to the video again and note down the technical points in case you want. So last year, through All India quota, there were 512 pediatric seats available in the general category, general plus other categories. Out of this, in round one, in first counseling, the last pediatric MD seat was taken in general category at 5132. So 5132 was the cutoff in general category last year, and in second counseling, the category was 5995. So almost 6000 was the cutoff in second counseling in general category for MD, right? This is in the general category. In the other categories, you had separate cutoffs. In OBC, the categories, the number of seats were relatively less. So MD round one cutoff was 3249. It actually ended earlier. And second counseling, it was 4549. In SC and ST categories, the first counseling cutoffs were 19,200 and 35,320 according to the website, according to the official data which is there. And in second counseling, it was 25,000 in SC and 38,000 in ST category. And in physically disabled, it was just a couple of seats were there, so around 80,000 something it went. So that is a standalone thing. So we'll not be going into it. So for general category, in case you have got a rank somewhere in the range of 5,000, you can hope for getting a MD general category seat from the All India quota. Please remember that state quotas vary across, and usually we find that you have a better chance of getting MD pediatric seat through the state quota as compared to All India category. So in all categories, whether it is general, SC, ST, OBC, or any other category we are talking about, student, if you look at the state category list, I'm not going to talk about all the individual state categories, but one thing is very clear, that you have a better chance of getting it. So if you have a borderline rank and you are getting a seat from totally 2,000 kilometers from your home, it makes sense to go in for the state counseling in case you have a relative surety of getting a MD seat. This is regarding the MD seats that I've talked about. Then we talk about the DCH seats. The diploma seats are decreasing each year. Last year, only 18 seats were available. So the cutoff for diploma DCH in first counseling through All India category was 10,124. That is 10,000 in the first round, and second round it was 13,660. Okay. So this was regarding the DCH. In the other categories, the number of DCH seats were too little, 1 to 1 to 1 to 3. So it makes no sense to talk about the individual categories. Then those who are having DU, that is the Delhi University quota, and IP, that is Indraprasth University VMMC quota. MD was available for quite late. We will, since it becomes a part of the state category, so I'm not going into the details. I'm just giving an example that in general category, even at 11,000, for those who were pass outs from Vardhaman Mahavir Medical College, they were able to get a MD pediatric seats, whereas they were ending at about 5,000, 6,000 in All India category in the general quota. So what it means is you have a better chance. That does not mean all of you leave your seats and go to the state quota. It will eventually come down to how many actual seats are available in each state, and what are your chances of getting that seat. Correct? This is the first thing that I wanted to talk. Second thing about the deemed university status regarding MDs. So in deemed universities, general category MD pediatrics, 273 seats were available, and the closing cutoff was 54,000 in first round and 68,000 something, 68,798 in the second round. But obviously, as you can well imagine, deemed university seats are not going to be easy on the pocket. So only if you are affording, your parents are affording, and you feel like that you have no other chance, then you should go in for it. Having said that, some deemed universities like Manipal, Sri Ramchandra Medical College are way better than almost, I would say, 50% of the government medical college seats. But life is all about balance. So you need to balance the fees you'll be paying versus the quality of education that you'll be getting. So this is regarding the MD seats as of now. I know I've rushed through this, but I know that the video will go on YouTube also later on. So you can always go through the video and write down these key points again. So I'll summarize. MD general category, first round cutoff. Last MD pediatric seat was taken by 5132. R2 second round 5995. Right. Moving further about DNB. Like DNB, the cutoff was way lower, as you can well imagine. I'm coming to DNB, Nancy. So first counseling 2020, the cutoff was 13,130. That is 13,130. The last DNB pediatric seat was taken. That means if you have a rank around 10,000 or 11,000, you want pediatrics, you will for sure get DNB pediatrics, but chances of getting MD pediatrics through All India category is less, right? And in second round, the cutoff was 14,380. So up to 15,000, you have a chance of getting DNB seat in the All India quota category in the general category, right? Obviously, in the other categories, you will have different variations. And you need to understand one thing. There is a very peculiar thing. This is the superficial thing which I have talked about. Deepak Kumar, I have never discriminated. See, I have never done that. I am not discriminating. I'm only talking about the list which is given out by the Ministry of Health and Family Welfare on their sites. Nowhere have I talked anything about it. I had told you before I started the video, there will be no talks about any other thing other than academics. I'm only talking about the cutoffs for each categories. I have talked about individual categories and I have talked mainly about the all India quota general categories, right? I hope you will be able to understand the things I'm talking are only technical things. None of this is my perspective. All of these are from the general quota, right? So afterwards, please do not bring all these things into us. All of us are Indians and all of us are equal, and caste is something we should not be talking about anymore, please. Having said that, let us continue with the discussion. See about yeah. See, please do not use harsh words. Please do not use harsh words. I request all of you, please do not use harsh words. We are all in this together. Some of us have strong opinions about certain things. It's okay. It's okay. Let us not talk about it. Let us continue with the discussion. It just throws us off balance. So I've talked about the category quota seats. I've talked about the all India quota seats, right? Initially. Now, what about the second thing I'll be discussing is a lot of students ask, sir, what are, yes, Adyasha, I'm coming to that only. What are the top medical colleges for doing pediatrics in India, right? What are the top medical colleges? So for doing pediatrics, overall best, obviously, not because I have done from there, but because I truly believe in it, that PGI Chandigarh is the best, followed by AIMS Delhi, followed by Jipmer Pondicherry, and then followed by some of the peripheral institutes of AIMS, which have a good academic output. This is, but obviously central institutes we are not talking here. If you talk about the state colleges, not in any particular order, because it will also depend upon your state of place, and there is very little to choose. But the top 7, 8 or 9 colleges which are traditionally considered to have a very good academics, very good passing rate, very good DM entrance success rate, they include Maulana Azad Medical College Delhi, which has now overtaken Lady Harding in by all means. No offense to Lady Harding, no offense to Hardonians, but Maulana Azad always goes better, and the academics are, the work culture is also better in the pediatrics department. Then Madras Medical College of Chennai, KEM Mumbai, VMMC Delhi, in South, GMC Kozhikode, GMC Trivandrum, IGI Child Institute Bangalore, UCMS Delhi, Kottayam Medical College, Bangalore Medical College, Varanasi, Thrissur, Pandit BD Sharma, PGIMS Rohtak, RML, and LTMMC in Mumbai. These are some of the top colleges that you can focus on. Among deemed universities, the best one for pediatrics is Sri Ramchandra Medical College, followed by Manipal KMC, followed by Mangalore KMC. These are the top 3 in deemed universities. If you talk about DNB, if you ask me personally, the best in India, if you look at entire thing, ranging from academics to the city to the quality to work atmosphere, it is Gangaram Hospital, no doubt about it. Followed by Kanchi Kamakoti, St. Stephen's, Mehta Children Hospital. Then there is a college in a BB Memorial in Calicut, and R.N. Cooper, Mumbai, and Rajagiri in Kerala. These are some of the top places with excellent passing out rates. In fact, some of these places have passing out rates close to 90 to 95%. 90 to 95% pass rates are there in some of these. So these are the top medical colleges. Now, these are the top medical colleges based upon the perspective. Now, I will talk about what students are actually taking based upon the last 2 years. If you go by the last 2 years, I will talk about descending order. That is, सबसे पहले कौन सा खत्म हुआ? The cutoff list I will be talking about, right? So the first one to finish in All India category, All India counselling was Maulana Azad Medical College. In first counselling, 230 pe it was finished. Despite 7 seats being there, second counselling went up to 370. So top colleges for MD. based upon what students are taking. Maulana Azad, followed by Lady Harding, followed by IGI Bangalore, followed by GMC Kozhikode. Then you have Vardhaman and RML in Delhi. People have a tendency to take in Delhi because Delhi has good stipend and central institutes and DM seats success rate is better. But that does not mean they are superior to many medical colleges. I'll come to that point in some time. GMC Kannur, Madras Medical College, BHU Varanasi, UCMS, GMC Trivandrum, KEM, Thrissur, Kottayam, BMC, Bangalore Medical College, Rohtak, and Osmania in Andhra, KGMU in Lucknow. This is the descending order list based upon how students have taken in the last 2 years. So you can very well imagine that the quality is also somewhere on those lines. Rohanacharya SCB Cuttack is the best college in Odisha. It has a few issues related to limited critical care exposure. But I have two of my friends from there. One of them is a DM, and she is a wonderful person. And looking at the caliber she had, and she has very high praise for the department there. And the SCP Cuttack, in case you get it, in case you belong to that area of India, I don't think you are going to regret it. So don't have any doubts in case you are able to take it SCB Cuttack, right? About individual colleges and your doubts, I will be taking up in some time. So let me first finish off the entire data which I have with me. Otherwise, the session will go on too lengthy. Then places last to get filled in. No offense again to anyone, but what are the places which are getting filled in the end? Reason being, they are either peripheral colleges or academics are not that great, or there are bonds. So the last to get filled in are places in Jorhat, Bilaspur, Silchar, Malda, Gaya, Bhagalpur, Agartala, Lehria Midnapur, Raipur, and two colleges in Patna. These were the last colleges to get filled due to a variety of reasons. Then talking about DNB, I've already told you, based upon what people are taking. Three Kerala colleges, Malabar in Kozhikode, Baby Memorial in Calicut, and KIMS Trivandrum were filled between 3,200 to 3,800. What it means is many people were taking DNB in these places instead of taking MD in a government college. What it means? It means is these places have a very good academic atmosphere. They have good passing rate, and end of the day, a lot of students don't want to fall into the trap of, I'll say relative trap of bond. So that is why DNB has some advantage in terms of going to a place where there is no infrastructure, long bond of 10 years is there. It is always better to go in for a DNB if you are getting from a good place where academic are very high. End of the day, in the coming years, it is expected that MD and DNB are going to be the same. That debate will come to in some time. So the top colleges in DNB which are being taken by students based upon every year, you have Malabar Kozhikode, Baby Memorial Calicut, KIMS Trivandrum, all three finished way before other places. Then RN Cooper Mumbai, Gangaram went up to 4,000, Lordies in Kochi, Kanchi Kamkoti went up to 4,500 last year, Rajagiri Kerala, Bokaro, St. Stephen, Dr. Mehta, Chennai, Chacha Nehru, Esther in Kochi, Dr. B.C. Rai, Kolkata. Regarding the College of Rainbow Hospital of Hyderabad goes quite early. Rainbow in other two cities goes quite late, almost in the end. So that reflects the academics at these places. So you should be keeping those things in mind. Kasturba Medical College, SS, excellent college. The only issue is money. But other than that, if affordable, you must go for it. Excellent college. About top deemed universities, SRM Chennai, KMC Manipal, KMC Mangalore finished within 15,000 general category ranks. They finished within 15,000. JSS Jagadguru, Amrita Kochi, Bhubaneswar, Kalinga, and JLNM Belgaum are also other deemed universities. Again, they are taken up somewhere in the range of 22,000, and they finish much before 25,000 ranks. Right. So these are about the places and their cutoffs that I have talked about. So this is the technical thing that I wanted to talk. Now let us talk about the perspective, the discussion. Again, whatever I'm saying is based upon what I have felt over the years. I interact with a lot of students. I've been into this field for so much time, and I do interact with people. So that is based upon what I feel. So what are the points that you should be considering while you are going to take a seat? First of all, the most important thing is reputation of the college and the pediatrics department. A lot of colleges, you will find that the college is very reputed. For example, Maulana Azad Medical College, very good reputation. So any branch you take in Maulana Azad is actually going to be good. There will be 19 ka difference might be there, but most of these places they will have excellent uh, reputation. That is important. Then you have to look at the pediatrics department if you can get some info regarding it. Second thing is bond. Lot of seats which have a strong bond or a very strict bond enforcement, even if the college is good, that comes lower down on your preference list, because end of the day you have to do DM also, and you may not be willing to work in the government sector, or you may have different priorities in life. If you are okay with the bond, absolutely fine. I'm not saying go for the bond or don't go for the bond, but usually the seats with a long, lengthy, stricter bond, they go much later. So that is one thing that you should keep in mind, not only the city, not only the college, but also the bond. Thirdly, language issues. See, end of the day, we all are Indians. All these caste things, all these religion things, all these regional things, we should not be talking about them. But end of the day, when you go into a medical college and you are not well versed in taking history of in a particular segment, end of the day you will have to take history examination, has to be done in pediatrics. And so knowing a bit about the language of that place is important. Having said that, in my when I was doing at PGI, in my batch of 14, there were two people who were Hindi speaking, and the remaining 12, all of whom are still excellent. We all are colleagues and good friends. We still catch up with each other very often. They all were not well versed in Hindi, but when they came over, English was good enough for most of them. So particularly in state colleges, language is not such a problem. Even if it is, it takes just a few weeks. You have cracked 19 subjects. Don't you think, workable knowledge of a language will hardly a few weeks it will take? So don't, diss a seat just because you think that you will not be able to understand the language. Given a preference, yes, you should be going into a place where language issue is not there. Having said that, if you are getting a place which is far from your place and some language issue might be there, all it takes is just 1 or 2 months for you to learn, and end of the day you will be learning a new language. Why close yourself to learning? So a workable language everybody learns. This language issue is less of a problem in branches which have less patient interaction, like radiology, like paraclinical branches, but it is more in clinical branches like pediatrics, medicine, to a certain extent gynecology and dermatology. So you need to keep these things in mind when you are taking up these places. Then another thing that you should be talking about is home city versus far fetched city. If everything is fine and you have to take in a home city, nothing like home. Nothing like home, I'm telling you. In pediatric residency, when you get frustrated, end of the day, you sleep in your bed. Or 2 days after 48 hours duty, you come back to your home and you eat food cooked by your mother. Trust me, half of the frustration in your life goes away. So having that home advantage is always better. I'll give you an example. I am sitting in Chandigarh, right? I am getting a seat in Chandigarh also. I am getting a seat in Jaipur also. Both are fine. Jaipur slightly more reputed than Chandigarh. But if I am me, I will be taking in Chandigarh. Why? Why to travel to Jaipur? Jaipur is 400 kilometers from Chandigarh. I'll have to keep coming and going. Secondly, I'll not be, in case of any, I'm getting homesick, and people do get homesick. Trust me, बहुत homesickness होता है. If you do get homesick, I'll have the advantage of being at home. And the academics difference is there, but not as much as between, say, Jipmer and AIMS on one side, and a peripheral state medical college on the other side. So this point of home advantage that needs to be taken. Then connectivity of the place is important. It is increasing. There are flights all around, so not an issue. How many subspecialties are there so that you get adequate exposure in that college? That is important. And finally, working NICU or PICU is there or not. Now, having said that, I always give an example here. Taking a seat is like getting married. You meet so many people. Some person has one advantage, some person has another quality, some person you like something, another person you don't like something. End of the day, you choose one. You choose that person who you feel you can carry your life with, who is the best possible among the persons you have met in your life. And once you go with that person, once you marry with that person, you don't look back and start thinking, what if I had married that man or that woman? You don't think like that. PG is also like that. The place you will be joining, do your entire research about it. There is no such thing as perfect place, but whatever seat you will take, once you taken, immerse yourself in trying to be the best in that, and trust me, life will be very kind to you. And end of the day, the place is only secondary. What is important is how much you have worked hard, how much hard work you as a person have put in. So that is important, that you need to keep in mind. Moving further, the second next contentious issue we'll be discussing is MD Pediatrics versus DNB. So this is a very subjective thing, and in general, MD Pediatric seats are taken up earlier compared to DNB. Exact choice you make will be dependent upon the rank as well as the life choices you make. For example, if you want to move into a medical college and work as the registrar or faculty, MD will be superior because the medical college atmosphere you get, the academic inputs you get, plus that bed wala ratio, although that has been relaxed, it makes you easier for you to make the transition to those places compared to DNB. Having said that, there are DNB people who are able to get in as well, provided you have done DNB from a reputed place. But somebody who wants to go into practice or into corporate sector directly after MD, after post graduation, or you want to do DM in say neonatology, there is frankly no difference between MD pediatrics and DNB pediatrics. In fact, I can vouch for the fact that DNB pediatrics from places like Gangaram, St. Stephen, and Kanchi Kamkoti are way superior in academics and practice experience compared to peripheral colleges where there is very little infrastructure and you do not get any academic teaching. So end of the day, you need to strike a balance between individual places, what you are likely to get at your rank, probabilities, and then sift out, make your order regarding MD pediatrics versus DNB. See, passing rate in DNB is a problem, yes, but it has vastly improved. When I was a student, it used to be 30%. Then till 2018-19, it became about 50%. Now, right now, 60 to 70% in first attempt is the passing rate. What it means is 10 people sitting, 6 to 7 will pass in the first attempt, 3 to 4 will have to sit again. But this does not take into account, this takes into account all the people. There are some places, as I said, they have a strike rate close to 90%, 95%. There are some places where the strike rate is low. Eventually it comes down to the person, the institute, and how much of academic environment, academic input you are getting. Do remember, not every student passes in MD also. So people fail in MD also. And end of the day, you can give exam after 6 months. At least you will not have to prepare again and go into that uncertain times and again start once over again. End of the day, 6 month na aisa nikal jata hai. I'm not saying, see, I've seen failures in life, not in MD, DNB wala part, but I've seen failures in other aspects. And I know that over a long term, it does not matter. 6 months here or there do not matter. What is important is the best possible thing you are getting at your choice. And people ask, sir, DNB low kehte hain, it is not good. See, people will say anything. Who are these people? People will say something. You have to decide. You are all educated people. Try to see what are your life priorities, where you want to settle, and based upon that and the thing you are getting, take a call. I give you an example. At 3000 rank, seats in general pediatrics, general medicine are available, and people are going for DNB by choice. They are not stupid people, they are smart people, and they are doing it deliberately. Eventually, it comes down to the college that you are taking and your choice in life. Then there is a question a lot of you often ask, sir, should I take DNB or prepare again for MD next year? See, it is a subjective decision you have to take. If it was your first attempt and you think कि अभी मेरे अंदर बहुत steam बाकी है, I have a lot of steam left inside myself, you can give another shot. Keep in mind, there is no guarantee that rank will improve next year. I know so many brilliant people, their rank actually falls when they keep on giving exam. It's a competitive world, and you know that next exam is on the horizon. If the pattern changes overnight, there is very little you can do. And who knows, you may look back and think, I should have taken the seat at that time. End of the day, whether you are MD or DNB, 5 years into the branch, it does not matter. It does not matter. It matters first few years. Somewhere the struggle might be there, somewhere the struggle may be less. 5 years into your post graduation, it will not matter. What will matter is whether you are a postgraduate in pediatrics or not, right? You can always make up. You get opportunities, there are ways to make up. Then, is DM essential in pediatrics? Not yet. Even today, at most places, general pediatrician has a better practice and earns more than a DM, especially in smaller cities. I'm a general pediatrician. I do not earn that much, but still, I have a decent practice. And if you want to work at corporate level, or if you want to settle in Delhi, Mumbai, suppose you want to have a practice, I want to practice only in South Delhi or South Bombay, then to MD pediatrics is not going to work. Then you will have to do a DM in a branch, not like neonatology, DM in, say, pediatric endocrinology, DM in pediatric cardiology, where still there is a gap in bigger places. So it is not essential. In adult medicine, yes, DM is relatively becoming essential in bigger cities. 10 years from now, the similar situation will be there in pediatrics also. But if you ask about today, compared to medicine, pediatrics still, you can earn a decent living by being MD pediatrics alone. Which DMs are available post MD pediatrics? I have a set of questions asked by you people only. So I've prepared my sharing my perspective based upon them. Then I'll be taking your individual answers. Maximum seats are there in DM neonatology. Then you have DM in 14 different branches now in pediatrics. DM pediatric critical care, pediatric neurology, pediatric rheumatology, pediatric gastro, pediatric nephro, pediatric endo, medical genetics, hemato-onco, hematology alone, pediatric pulmo, and so on. So you have a lot of choice. But remember that patient base will be narrow in all these DM pediatric branches. You will be a super specialist, but the patient base will be less. Private practice will be tricky. You will have to sit in a corporate hospital. If you want to sit in a small hospital, open the shutter yourself, practice till as much as you want, and then close the shutter and go back and take a holiday whenever you want. DM is not going to cut ice with you. You will have to sit in an institution in pediatric DMs. Options after post MD pediatrics. What are the options? You can join medical college as SR registrar. You can start a small private practice. You can join a state medical college as assistant professor. Start private practice. Takes a lot of time. Patience is needed, but very little investment. You can join a corporate job. Corporate jobs are very easily available in pediatrics. That you may not feel, passion about the branch. That is a different thing. Do DM in pediatric subspecialty. You can do fellowships. There are again 10 to 12 different fellowships available. You can join government job. You can go for UPSC. You can do MRCPCH. Try to go abroad. You can work for a few years. Middle East has a lot of opportunities. Every year, Qatar, Oman, Saudi Arabia, and Abu Dhabi, they look for pediatricians, and they give packages ranging from 4 lakh to 6 lakh rupees per month, with free accommodation and free food for the person and their spouse. You want to take your entire family, pay a bit extra, but you will have to sign a contract, and it's a limited thing. You don't get residency, but such packages, particularly for people who are coming out, have some publications, they are there. Radiologists, dermatologists, pediatricians are always in demand, and emergency medicine specialists in the Gulf countries. So if you just want to earn 6 lakh rupee per year for maybe a couple of years, make some money and come back, that is another option that people explore. And you can join a PhD program if your research ka kida hai, so you can go into research as well. So these are the options that you have regard after MD pediatrics. Now we are coming to more sensitive things. I'm coming to the questions which you are asking. So I have never felt comfortable working with kids. I am scared I may hurt kids. Can I still be a good pediatrician? It's a risky branch, people say. So yes, my view on this is, there was a time you did not know how to walk. There was a time you did not know how to swim or to read, but you did that, right? All of these were skills you learned. Once you go into MD pediatrics, you will learn how to do it. All you need is willingness to learn and patience to learn. Kids are wonderful teachers, and kids are always better than adults. Trust me. They are much better than adults. Adults will get cured, still they will cry, "Ah, kuch nahi hua. Baba ji, how are you? Arey, life is bekar." He will never be satisfied. Kids, you don't need to ask the kids. Look at the kid, he's playful, joyful. You know the kid is fine. Look at these parameters, ask the parents, you will be good enough. You'll feel uh, a sense of contentment in that. It takes time to develop. When I was a student, I always used to take shortcuts in MBBS. So what I would do is I had small contact in my internship, so I did not go for internship at all in pediatrics. Only went for 2 or 3 days. So nature, life, karma came back to me. I ended up doing MD in pediatrics. The first day I went into PGI, I knew nothing about kids, so I was scared. But 3 days later, I was doing all the procedures. I had learned intubation. I had learned all these. I was also, putting central lines in 1 week when I was into there. So once you have people to teach you, once you are in a good place and you have willingness to learn, all it takes is a few days. End of the day, a patient is a patient. Whether it is an adult or a child, you have to treat him gently, with passion, with patience, and you will learn it. So kids are not that difficult. In fact, you need to learn how to build a rapport with kids. It takes time, but once the skill is there, you'll do well. So don't worry about it. Dark blue, I have already talked about DNB versus MD. There is a complete video I have put separately, so you can listen to the discussion again. And I have talked about these things as well. I'll summarize in the end. So a lot of students have asked, if I get DCH, should I do it? First of all, DCH seats are very less. My perspective on this is very clear. If you are getting both DCH and DNB, go in for 3-year DNB rather than going for 2-year DCH. Pediatrics as a branch, if you do 2-year DCH, 2 years is not sufficient time to learn the requisite clinical skills. It is not sufficient. So, and eventually you will have to do a 2-year DNB afterwards. So go in for 3-year DNB from a good place rather than going in for DCH. Again, that is my personal perspective. Again, students are asking, will my life be too busy in pediatric residency? Yes, your life will be very busy in pediatrics residency, at least for the first 6 to 12 months, but then you learn to adapt. And you also start to learn better, life quality improves. Please understand, except for branches like dermatology, most branches, even radiology, even psychiatry, even pathology, they will have first year is going to be very hectic. You will be getting night duties. So MBBS is like, kindergarten. This is real life. This is the beginning of real life for you. So you have to be mentally prepared. Residency is going to be tough. There will be periods of frustration. For it, everyone passes through these phases. You have to be mentally strong for that. Once you go through them, you will realize that it was just a learning experience for you. Students have asked, will life be post busy MD as well? Yes, your life will be busy post MD, but it will be as busy as you want it to be. If you want to go into critical care, or if you want to work at two places and earn double the money, your life will be busy. In case you want to go in for only OPD based practice, avoid night duties, or go into a branch like DM pediatric endocrinology or DM medical genetics, you will not be getting much emergencies at night except for occasional diabetic ketoacidosis. So you will have a better quality of life. You will have good money, good finances as well. So, and like in my case, I by choice decided I will not do DM. I will not do emergency duties. So every 9 o'clock at night, I am at my home. Of course, my earning only through pediatric practice will be less than somebody who's working at two places or somebody who's doing night duties. But it's a choice I took. Since I have academic interests also, so I get compensated financially from there. So end of the day, eventually everybody comes on the same platform. So it is a decision that you can make. But yes, first 3 years of MD and probably 1 or 2 years after that, you will have to do night duties. Life will be tougher. People ask कि sir learning curve steep होता है? Yes, learning curve is steep in every branch. You think that you have read Harrison a lot, so you can treat a patient based upon what is given in Harrison? No. Treating a patient will come when you look at the patient, when you spend time along the bedside. So learning curve will be steep in every branch. I personally feel learning curve is steeper in a surgical branch compared to a medical or a physician oriented branch. So learning curve in pediatrics is definitely easier compared to branches like ophthalmology and orthopedics, which have a relatively longer learning curve. When I say longer learning curve, I'm not talking about in orthopedics about putting plaster of Paris cast. I'm talking about actually doing surgeries, talking about Elisaro fixators and use of all these tractions. Then, what about the risk of violence we hear in news in pediatrics? Violence is a part of the system. Unruly crowds and occasional bad experience can happen anywhere, anytime. Everybody has faced that. We need to be humble, we need to be practical, and we need to learn according to the branch. Once you become a resident, you will learn these skills, you will learn on your work field as well. Is MD medicine better than MD pediatrics? A bit immature question. No personal offense, sorry, but immature question. It varies from person to person. There are people who like pathology, there are people who like microbiology. For them, if you give them radiology or derma, they will not take it. So, end of the day, what you like is more important than asking randomly what is medicine. Patient pool in medicine is bigger. DM in medical branches, earning wise, is better, but if you only want to do a small practice and if you like young kids, then MD pediatrics is better. I had a choice to make in my counseling in PGI. I made the choice for pediatrics. You will have a choice to make. You ask yourself, what do you want? Are you okay with kids or you hate kids? If you hate kids and you want only medicine, go in for medicine. It's fine. If you like kids and if you're okay with the branch, learning you will come eventually learning will eventually come with time. Then you need to go in for either of the branches. You can safely go in for pediatrics. But remember that patient pool in adult medicine is always bigger when you start with the practice. So pediatric practice takes time to develop. How much can I earn? Depends upon the career trajectory you take. How to go about my residency? See, initially adapt, learn procedures for 6 months. You will not be able to read. Academics will be variable. There are some places, top colleges, DNB and MD, which I named. They have excellent seminars, excellent teaching. But in post graduation, most of the learning is passive. So you need to learn yourself. Nobody is going to come and teach you like it happens. Um, there is no substitute to reading Nelson in theory and no substitute to actually managing patient in the ward. Even if you open Nelson and you have the protocol of how to manage hypernatremia written in your hand, child is having hypernatremia with sodium of 156 and throwing seizures. That Nelson is not going to come effective. You will have to manage the patient yourself, and this is something you will learn in your wards, in your emergencies, in your when you attend the clinics. So that is something you should be willing to learn and try to strike a balance. Mostly people, and if you want to crack DM entrance exam, you should start reading from the end of first year itself. And other than that, I'm still around. You will be taking MD pediatrics. You will be joining. Stay in touch. I keep posting, in my groups. I have Telegram groups and all. I'm not doing publicity. Don't worry. Those are free groups. I keep posting, changes in guidelines related to residents and stuff like that as well. So you can always stay in touch with me. Like me, there are other excellent pediatric faculties also who have a passion for teaching. So they keep on posting. So you will have material. In today's times, there is not a paucity of material. There is plenty of material, but you should have the willingness to learn. And lastly, what are the points to remember after I take up pediatrics? Learn patience. Children and managing their parents, it requires patience. Learn and develop skills which will maximally happen in the first 2 years of your residency. That is critical. Then stay humble, well-defined goals in mind. A lot of people don't know. MD करेंगे फिर देखेंगे. What देखेंगे? You should have a particular goal in mind. Where do you want to go? I want to do DM. I want to go into practice. I want to go into service. You should have clear-cut goals in your mind. You have time, join the branch and decide in while doing the branch itself. Don't be random. A lot of people do random things. They do MD, then they join a place, work for 6 months, then they go abroad for 1 year, come back, and then they start asking, "Sir, I've wasted 1.5 years. What to do?" Don't be such a you will be in your late 20s and early 30s. You're not immortal, right? You're not eternal. So you have a limited life. शादी करना है, बच्चा करना है, पैसा कमाना है, BMW लेना है, and you have to do something for the society also. We have a duty towards society. End of the day, you have a private practice, at least 1 or 2 patients who can't afford. You should be seeing. In case, don't do it for free. Nothing should be done for free, but you should be giving something to the society back. So for that, all these things you will need time. So the earlier you attain your goals, the better it is. and be flexible in life for opportunities. When I was doing MD, even third year of my MD, I never knew that I will be taking a YouTube session like this and talking about stuff like this. But I was open. I was sure I will be doing MD, and if opportunities come, I'll be considering them. I got the opportunity to teach. I love to teach. I grabbed it, and right now, all through my practice, till my practice picked up, my earning from the academics helped me stabilize myself only because I was open to it. So life will be open to you, but Rahul P, no, shadi is your thing, है ना? Shadi with bacha, shadi without bacha, bacha without shadi. That is all your choice. That is your personal decision. I'm just giving an example, right? And lastly, as a general advice, before I finish off and take it for open session, 10 minutes, I'll be answering your queries quickly. Do not run after money. A lot of people ask, sir, pediatrics में पैसा कितना है? See, pediatrics में ना, if you look at only from money point of view, नहीं है. Trust me, नहीं है. You can earn more being an orthopedician and managing trauma patients, putting POP casts. You can earn more by taking normal deliveries day in and day out. You can earn more by working at 3 centers in radiology and giving your experience. You can earn more by putting fillers, botox, and giving luliconazole for anything which looks like fungal. It may or may not be fungal. Look, no offense to dermatologists, but anything looks like, oh, you give combination of luliconazole with that or this. So those people will earn more. Pediatrics is not a procedure-based branch. Any branch which is not procedure-based, the OPD practice alone will not give you money in a continuous stream. But pediatrics as a branch, you will not attain a plateau. You can expand yourself, you can do fellowships, you can work at multiple places, you can be a specialist, you can learn skills and gradually increase the practice. So immediately paisa nahi aayega, but it will take time to come. But end of the day, if you're good in your branch, if you're humble, and as I said, you are looking for opportunities, life will be kind to you. So I have not seen any pediatrician die of hunger. There are people who earn more. There are people who earn in 7 digits per month in pediatrics. Yes, there are people who earn in 7 digits in paraclinical branches also, and there are people who earn in only 5 digits in radiology, pediatrics, dermatology as well. So there are high earning people, low earning people. Eventually, it comes down to the decisions you make and the skills you have. So don't run after money. Money is important, very important, but do not run after it. Run after skills, look out for the branches, and money will come to you. It does come to you. Trust me. I'm a classic example of that. I'm not saying I have a lot of money, but whenever I have faced financial troubles in my life, my skills have helped me out. My MD degree has helped me out. Whatever I am today is because of pediatrics, and that is why I take all these sessions and discuss all these things with almost last 2 years I was unable to do it, but now I thought I should be sharing all these views with all of you people. So let us begin with with your doubts. That is all I had to share with you. And for those who were talking about again, all these are my perspective, and these lists and data I have shared with you is based upon what is available in public domain, the government data. No offense to anyone, and perspectives, these are all my perspectives. They may be right, they may be wrong. And for those who were talking some illogical things, I have not talked anything illogical. I know what I am speaking. At the same time, we should not be talking about these small petty things about region versus religion versus caste versus this or that. End of the day, we are all doctors, and being specialists, you are all going to be specialists. And a few some time from now, you will not be my students, you will all be my fellow colleagues. You will run into me into some conference. Usually I am found in conferences in the last row. I have always been a backbencher in the last row, sipping coffee and answering some queries. That is how you will find me in most of the conference halls. So maybe someday we will meet and have some coffee, and you'll also sit with me on the back row seat. So looking forward to that. That is all from my side. Let me take some of your queries. Too many queries. I don't know whether I'll be able to solve all of them or not. Jo reh jayega, you can message me on Facebook, on Telegram, whatever place. I'll try to answer to the best of my ability. So, DNB colleges of Delhi. Chacha Nehru versus DDU versus Hindurao versus Baba Saheb. Chacha Nehru, best academics, followed by DDU, Hindu Rao, Baba Saheb, almost at same level. Budrika Gupta, work-life balance, you have to decide. In case money is more important, you don't have a family, like you have a small family or not yet married, no kids, you can work 2-3 times a day. At one point in my life, I was working at 4 places. I was taking classes for dams, I was working in a private medical college, I was seeing patients at home, and I was working doing night duties in a corporate hospital. These days, I'm too tired, I don't have time, so I just have a small practice, and I take classes. I do recordings for the commercial ventures I have, because it's a life decision you have to take how much you have want to be busy. Uh, Hi from IGMC. Hi. Can I get DNB Pedia at 17K rank? Blue Papaya, according to last year cutoff, it is a bit tricky. Last year it ended at 14,380, but you can never know. You should give it a try. Can you please rank Delhi colleges, Mumbai colleges, UP colleges for pediatrics? Yes, Shakib. In Delhi colleges, MAMC is the best. UCMS traditionally has been the better MD pediatric, but the problem is UCMS patient load is too high. Academics have gone down in the last few years, and too strict people, too strict people in the department. They are excellent academicians, but end of the day, you need work-life balance in residency also. So MAMC give you slightly better life quality. So that is one point. Then RML and Vardhaman almost at same level. Then comes your UCMS in Mumbai colleges. In Delhi colleges, in Mumbai colleges, SET GS, that is KEM, is the one which is picked up early, which is the best. Then you have Lokmanya Tilak, which is the second best, followed by TN Medical College and Grant at same level, and then you have Sion and others. UP colleges, obviously BHU is the best, followed by KGMU. How is CMC Vellore Pediatrics and Information? Yes, CMC Vellore Pediatrics is excellent. Hi from my agency. Hi. After MD Pediatrics, how the future prospects are going to be? Oh, this comment list is going too fast for me to respond. Sushil Kumar is saying, don't take pediatrics, your life will be a professional mess. Sushil, it's a personal thing. There are people who make a mess of their life after taking uh, radiology, after taking doctors, becoming doctors after being MBBS. So it is all in our hand how we want to do it. Kirtipuri, GMC Chandigarh is an excellent place. Academics, not that great, but still, if no bond, good city, good college, good stipend. So you can consider GMC Chandigarh, but academics, a bit shaky, lesser than other places. Hote hain, but not still that great. SMS Jaipur for pediatrics, Rupal, excellent college. Only issue is bond, and because the college is not so big, so many residents are there. In procedures, you do not get that place, but still excellent academics. Academic wise, GMC SMS Jaipur is better than GMC Chandigarh, better than all Punjab colleges, better than IGMC Shimla, better than all UP colleges as well. In DNB, Holy Family, BARC, Batra or Nanavati. DNB, Holy Family and Nanavati are better from as far as pediatrics department are concerned. Priyanshu, I have already told. MAMC, LHMC, VMMC, RML, UCMS. That should be your sequence. KMC Manipal, excellent college. 10K rank. Should I go for private seat MD or choose DNB? Ulas, it's a personal decision. If you can get private seat MD and you can afford that, go in for KMC Manipal or KMC Mangalore. Excellent colleges. Good period DNB institution I can get at 11K in northern states. You can try Delhi colleges. If not possible, there are other state colleges. There is Golden Hospital, Jaipur Golden Hospital, which you can get at 11,000, and it has gone once at 11,000. It's a relatively good college in northern state. There are some in Noida also. They have good academic exposure. If somebody has done MRCPCH after MD, they will become equivalent to MD pediatrics. Is it true? Himanshu Sharma, partially true. Partially true, because in terms of employability and doing practice is fine, but employability, you will be at a handicap. DNB Pediatrics in Mumbai, Dimple, I've just told you that in Mumbai, for DNB Pediatrics, let me just have a check. RN Cooper is the best, followed by your Nanavati is also good. Yeah. Then, how's DY Patel Navi Mumbai? DY Patel is fine, but DY Patel comes somewhere on the 10th or 11th number among deemed universities in the private colleges. Leelavati Hospital is good for DNB Pediatrics. Madhu Reddy, You need to learn how to handle emotions and attachment towards kids and parents. End of the day, you have to look objectively. Whatever thing you are doing, you should counsel the parents and take their written consent. Consent is very important, and handle the kid like he or she is your kid. You may not be having kids, but if you try to think that this is my kid, at the same time maintaining objectivity, and in case you feel कि आप नहीं कर पाओगे कोई procedure, you should have the humbleness to take the help of your senior or somebody who's better equipped than that. If you're patient, you're humble, and you have the skills, and you counsel the parents well, you'll do excellent in pediatrics. Between SSM, KM, Kolkata, and Grant Medical College in Mumbai, two entirely different things, Ayan. But I would say Grant Medical College a bit better. Stipend wise also, it's better. Leena Sugumaran, SK 6K rank, MD or DNB. Again, it's a personal decision you should take. MD, you will be not be getting either, or you'll be getting in a deemed place, or you'll be getting in a place where academics will not be good. DNB, you will be able to get it a very good place. So unless देखो ऐसा नहीं करना कि you take DNB because sir was saying and then you curse me for the rest of your life. It is a individual decision you need to take, and you should be clear in your mind that I am going to be DNB pediatrics, and whatever gaps are there I will be able to cover in the next couple of years. But yes, MD is always preferable to DNB. Having said that, DNB in a good place with good academics is better than MD from a poor place, or those places where non-existent infrastructure is there. MD Pediatrics from Delhi or Mumbai around 800 rank. Which one will be better? I would say MD Pediatrics from Delhi. Sagnik, for the simple reason, better stipend, more patient inflow, no bond. Academic wise also, they are equivalent. So Delhi takes the cake here. Punjab, which college for pediatrics? Frankly, unfortunately, I'm a Punjabi, but Punjab has, it's like choosing between the lesser evil. So pediatrics is not good in any college compared to other places, but usually we find that Amritsar these days has better academics compared to Patiala. Patiala used to be earlier, but academics have gone down. So Amritsar, then Patiala, then Faridkot should be your sequence. Then DNB Pediatric Delhi Hospital preference order, I've already told you. Gangaram, Saint Stephen, Chacha Nehru, DDU, and then others for DNB Pediatrics in Delhi. And we prefer Chennai or Delhi. It's your choice. Which city you like? I like Delhi. My half maternal family is in Delhi. I like Chennai. Spent a lot of time there, and other reasons I'll not talk about. So DNB Pediatrics Delhi hospitals preference order I've already told you. MP or West Bengal Arjani Patra. It's a you need to see the individual college. You cannot go state-wise here. Tata Mains, Jamshedpur, and Bokaro are excellent places for DNB. Narayan Hridayalaya also very good. Bhilai, again, traditionally it has been going much higher, but academics are a bit shaky. Please ask about residents over there. Try to talk to the residents if you can possibly over there. My rank is 3K. Vibha is asking, interested in both MD Pediatrics and MS Ophthalmology. Both are satisfying. Please guide which has better scope. Vibha, scope हर जगह है और scope कहीं नहीं है. It eventually comes down to what you have taken. Actually, scope was more in civil services and IIT and IIMs compared to medical branches. But now, since you are a doctor, so now you have to find the best scope. You decide where you want to be 5 years from now. If you want to be, if you're okay, see, I'll compare very, very easily. Both of them are excellent branches, MD Pediatrics, MS Optha. MS Optha is a surgical branch. And if you are getting from a place where you are not getting cutting chances or not getting to learn anything, you will be at a loss, and you will have to do a 3-year fellowship to learn your skills. So it will take time. Plus, doing senior residency in MS Optha is not easy. Number of senior residency seats every year in all colleges is very limited. So you will have to do fellowship, or struggle at some place at some level in ophthalmology. In pediatrics, these problems will not be there. Having said that, uh, ophthalmology is a procedure-based branch. So one MD pediatrics sitting in one cabin, one MS Optha with a LASIK machine sitting in another cabin. Optha person will earn better. But how you are going to reach that cabin stage, that you have to decide based upon your priorities in life and your financial status in life, right? Then West Bengal college sequence, including peripheral colleges. Shivangi Singh, individual colleges, very difficult to say. Kolkata Medical College Calcutta is the best one, and usually the Bankura College gets filled in the end. That is the last. So all other colleges come somewhere in between. Durgapur actually has a good college compared to what people like to think. Yes, Sushil, even after getting into DM neonatology, pay will be very less. Initially, pay will be very less. The reason for that is DM neonatology is now very saturated. DM cardiology and DM neonatology are the two most saturated branches in India right now. Even after DM cardiology, one of my very good close friends, close juniors, is struggling. Harsh fact, but true. He's struggling. He's not getting a place. He will eventually have to go to a place which is 4 hours from Chandigarh and do 4 hour daily travel up and down to earn a decent living. Obviously, with time, he will settle down. But that is the problem with DM cardio, DM neonatology, DM MCH in the CTVS places like these. The options are not there. Then Haryana good DNB institutes. See, in Haryana, usually you have people going for Haryana does not have many places for doing DNB. Most of the places in DNB in Haryana are mediocre. You can go in for places somewhere around Delhi, or you can even go in for places in a bit south. You will get better options over there. DNB Pediatric in Kolkata, Arunima, if you are able to get BC Roy, excellent. Excellent in that. Then college is possible for DNB at 13K, Nancy. DNB at 13K, let me just check. You will be getting the peripheral colleges from what the list looks like. So you'll have to make a decision based upon what best is available. PGIMS Rohtak still does not have a bond as far as I know, but if it comes into this year, you'll have to confirm from individual places. And Odisha's CB Pediatrics, Suchismita, it is very nice. As I said, one of my friends is from SCB and she's good. She used to be very good in her clinical skills. Can we keep MRCPCH as a backup option? Yes, you can. Any universities you can recommend? Scope in India, Ishan. I think you have messaged me this thing also. It's tricky. I'll talk about it. I'll send a detailed message about it separately. Corporate from DNB. DNB from a academic place is better than DNB from a corporate hospital. Should I opt for a government medical college or good state private medical college? If you can afford a private medical college without bond, go in for that. But money fees issue, you'll have to look at it. 7K Kanchi Kankoti, difficult, but if you get it, do not miss it. Ranks 9.6K DNB, please suggest 9.6K. Again, you'll have to have a look at the last year list. They are available in all the Telegram groups. Individual list you will have to see and then form your individual pattern. Aryan 1819 MD Pediatrics in IGMC, fair. I would say fair. There is a bond, but other than that, it's a good place. You can do it. Rageshwari, I've talked about medicine versus pediatrics individually. Also, medicine has a more bigger patient base, and people who want to do medicine do not need to be convinced for doing medicine. Frankly, JNMC Raipur, excellent college. If you stay in that area. In UP, good DNB institute. I just said UP Noida places are good. Then there are a couple of places in UP that I'll post separately. 3300 peds possible at Delhi. Tanya, tricky in MD. In DNB, of course, you can. In fact, at 3000 you will get Gangaram. If not in first, in second, Gangaram or St. Stephen, go in for it. Then language problem in South, Shivam Gupta. Language problem can be there, but end of the day, everybody knows it, English. And if you have some problem in understanding a particular regional issues there, you can learn. Workable language you learn in 2 or 3 weeks. Gulukam Saladi, my daughter ranked 28199. Sir, it will depend upon what she wants to take and what are the places you are getting. It's very difficult to say only with 28199. It is difficult to get directly in the government medical college. How is Dr. Bisira Children Hospital? Ajit Kumar, excellent college. I would say number one DNB college in Kolkata, better than many places. Good DNB and MD Pediatrics in Karnataka. Sushmita, good DNB in Karnataka. Lot of them. In fact, I would say except for 2 or 3 colleges, most of the places in Karnataka are actually good. MS Ramaiya for Pediatrics, average college. 12,000 DNB Pediatrics possible? Yes, but you will have to wait probably for the second round and peripheral colleges you will be able to get. Is secondary DNB necessary? Madan Gopal, if you are doing DCH, it is necessary. If you are doing MD Pediatrics, not needed. RPGMC Tanda, Himachal, tuberous sclerosis. RPGMC Tanda actually has better academics than IGMC Shimla. Fact of life. How is MS Ramaiya for pediatrics? Fair College. MD Pediatrics at GMC Sholapur or Aurangabad? Both Sholapur, Aurangabad at same level. Both of them have fairly good, academics, like any state college will have. DNB, is there state quota? No. DNB counseling, this is for all India category that is done. Can you do MRCPCH after DNB? Yes, Abhilasha, you can. How is any good DNB at 10K? 10K, yes, you will be able to get good colleges across all 4 zones of India at 10K. Can I get 19K pediatrics in Karnataka DNB? Difficult to get. I think it is difficult to get based upon last year's standards. Aditya Memorial Pune DNB pediatrics, average. You can go for it in case you don't have an option. SJ, KGMU versus IMS BHU. BHU, better department than KGMU. DNB colleges in Chhattisgarh. Chhattisgarh has a couple of colleges. Individual details I'll have to just go through once. See, end of the day, you need to understand. I'm not a working computer. Also have to think the way you are throwing these firing comments at me. What is better to do, DCH or DNB, and then DNB directly? Kriti, DNB directly at a good place is better than DCH. DNB, how is KEM Pune for DNB? Akshara, go for it. KEM Pune is actually good than many places. In fact, Pune, you have that Mangeshwar College and DNB and KEM, both of them are good. How is MKCJ Berhampur? Berhampur is an average college. DNB Pediatrics in Chandigarh, you will be getting at GMSH 16, not good academics, but you will learn. DNB in Chhattisgarh, I'll have to check. MD Pediatrics at 3500 rank in Udaipur, Rajasthan. Udaipur. Second round possible. Better chance through state quota if you have. Till what rank DNB is possible in pediatrics? Arnab, I've already talked about it. Till 14 to 15,000. MD Pediatrics, you can get in general all India quota somewhere around 6,000. In DNB, you can get up to 13 to 14,000. DNB OBC categories are there. See, OBC categories and all these things will be made clear. These categories and all these things keep on changing every year, so I'll not go into the details before somebody misunderstands something and starts abusing me here. So DNB at Fortis, yes, Fortis. There are many Fortis. Which Fortis are you talking about, Krish? Rank is 7,000. MD Pediatrics possible? Yes, MD Pediatrics possible through state quota. MD Pediatrics possible in deemed university, not through All India. In 11.9K rank, should we take DNB or try for MD next year? This is my first attempt. 11.9K rank, Disha, it's a tricky thing. I've already talked about it. You can message me and I'll send a detailed reply to it. I'm already tired. Just a second. Continuously speaking for 1 hour. Just give me 2 seconds to catch my breath. Hira Tahir, Mehta Hospital, excellent place. I would say Mehta Hospital in Chennai, the kind of critical care exposure you will get. And Dr. Shashidharan over there, he has been my boss. He has treated me very harshly. I used to dislike him at that time, but now he's good friends with me, and I think he's the best teacher you can get in learning critical care in pediatrics from there. Mehta Hospital, excellent. VMMC versus RML for MD Pediatrics. I would say VMMC. Again, there are people who like RML. RML a bit more laid back. VMMC hectic. But end of the day, you need more kids to see. So VMMC stipend acha hai. More stipend. Sushil Singh, Saint Stephen Delhi or Sir Gangaram or CNBC for DNB. Tricky Sushil. Gangaram, Saint Stephen at par. In case you are planning to do MRCPCH or go into critical care, I would say Saint Stephen is better. But Gangaram, other branches, they are good enough. CNBC, again, Chacha Nehru you're talking about. Chacha Nehru is inferior to both these places. But it's not inferior per se. It is definitely there among the top 10 colleges to do pediatrics in India. So all three of them are in the top 10, I would say. One thing you are missing out on, there are 4 or 5 colleges in Kerala which have excellent academics. Excellent academics. So places like Malabar, Kozhikode, Baby Memorial, Calicut, Kims, Trivandrum, and Lourdes in Kochi. Do consider them. End of the day, if you go out of your city, Whether you are going to 1 hour place away or 4 hour place away, doesn't matter. Anyways, you're not going to come back your home every night. Rajasthan versus MP versus Gujarat at MD Pediatrics. Sadhana, it is very difficult to say like that. College wise, every state has colleges with good academics and colleges with okay academics. KEM Mumbai versus Sion. Shivani, KEM Mumbai, no doubt about it. How is MD Pediatrics at GMC Sholapur or GMC Aurangabad? Both of them are fair, as I just told you before also. DCH cutoff rank. DCH cutoff rank last year was 10,124 in first counseling and 13,660 in second counseling. 5.8K MD Pediatrics in Rajasthan possible. DNB Pedia, for sure you can get Astha. Rajasthan state category you will be able to get. All India seems difficult. Morning Moon, MD Pediatrics at Rohtak. Rohtak, where is Rohtak gone? Yes, you will be able to get it. Rohtak is available somewhere in the range of 2,500 is the cutoff. Fortis Mumbai. Krish, Fortis Mumbai is okay college. I'll not say very great. Bhilai DNB, fair enough. In fact, Bhilai is getting filled much before many of the other colleges. But Bokaro is better than Bhilai. 16K AP State DNB Pediatrics Rainbow Hospital or Mumbai Lilavati. Difficult to choose. Syed Mohammad Yusuf, if you belong to AP, better to stay in AP. Rainbow is good enough. Mumbai Lilavati is good, but not as good that you have to choose. You have to change your place and go over there. So DNB Pediatrics, Rainbow Hospital is good. There is Kim's Hospital also. Academics are a bit shaky, but patient exposure is good in that place. Then MD Pediatrics and MGM Indore or Gandhi College Bhopal. Tricky, but pediatric wise, college wise, Bhopal is better. Pediatric wise, MGM is better. CPS Pediatrics good. It's fair, you can say. DNB Pediatrics at Artemis Hospital, Gurgaon, above average. Ispat Rourkela, Odisha. Rourkela, Odisha. I put it. I put it under. I've discussed it, and it is in average category. Lilavati versus Kokilaben. Lilavati. Karnataka DNB best college again. You need to tell the individual colleges. Right? It's difficult for me to say like that. Rank around 1,000 is MD Pediatrics possible in Delhi? Yes, it is possible. So Soma Gupta. Lilavati versus Kokilaben, I've already told you. Apollo Delhi DNB Pediatrics, above average. Above average. I'll not say excellent, but above average. BHU versus Mumbai College, BHU. BHU, there is a problem. BHU, not the department itself, but the college overall. In fact, this is a problem in many of the UP colleges. You may first 1 or 2 or 3 months, some adjustment issues might be. I'm not saying they're bad, but some degree of, it's like thoda sa senior junior rapport needs to be built up, and initially the workload is a bit more. So that kind of a thing, that work atmosphere, you need to make the transition if you're coming from a very cool, MBBS life into that place. So that transition thing will be there in UP colleges. Having said that, BHU is an excellent department. Yes, Somasyan Gupta, I've already told you it is possible. MAMC at 757 OBC. Priyanshu, I'll have to see the OBC category separately. Borderline chance. Difficult, but there is a chance of you getting it. Pune Bharti, yes, it's a good college. Scope of DNB in Pediatrics, Dr. Koch, if you listen to this video later, once it goes up, you'll find that there is scope in that. I've talked about DNB scope in details. You can do multiple things after that. I've already talked about it. So I think most of this list will go on and on. I'll have to stop somewhere. So let me summarize the things which I've talked about. So the things I want to say here is, see, let me simplify the things. Whether to take or not to take a seat, it's an individual decision. If you have given 2, 3, or 4 attempts and you are in a position where you will be getting a pediatric seat, I would say go for it. That does not mean I'm doubting your ability to score again. It's just that you should not be wasting so much of time. End of the day, we are not immortals. You have a life to live, and you have specializations probably to do in later life. When I say one college is good and one college is bad, these things are relative. End of the day, even if it is from a place where academics are not good, where you have not been taught well, or you're not sure about your place, still you will have a degree in hand. And if you've passed MD or DNB, you would know the theoretical basis. It's not a procedure based branch. You can go for SR ship, work in a government place, work on your skills, and be a better pediatrician. Learning will continue after this as well. Even today, I'll read Nelson. Today I learn so many things on a daily basis. So learning will continue. So end of the day, if you wanted to be a pediatrician and you're getting a branch, you should go for it. Having said that, if you feel that this is your first attempt and you still have that firepower in you and you want to take another chance, you should go for it, keeping in mind that there is a chance your rank may slide even further. There is a chance paper pattern may change next year, or there may be even more clustering next year. So that risk benefit ratio has to be balanced before you take the final call. So that is what I wanted to say. MD and DNB, there is some uh, difference between the two. MD usually people prefer, general public also MD a bit favor, but this distinction is blurred in case you want to do private practice. And as I keep saying, doing 3-year DNB from a good place is better than doing DCH, feeling inadequate, and going for this 2-year DNB again afterwards. End of the day, even if you take up a place where academics are not good, people say कि कहाँ ले लिया, and you start feeling if you have made a mistake. No, you have not made a mistake. End of the day, you will be getting a degree. 3 years you would have seen children, you would have read Nelson. Even if your skills are not 100%, only 60%, you will have time to work in a place, you will have time to do fellowships, you will have time to do DM, work on your skills, and be a better pediatrician. I am a better pediatrician today than I was 3 years back, and I know that I will keep working to be a better pediatrician 3 years later. So we keep evolving in life, and that evolution will happen in your case, each one of you as well. So what is important is you choose a seat. Abhi jitna dissection karna hai, ask people about it, discuss with the residents over there, look at the pros and cons, look at the bond value, look at stipend, and then take a call. It's like marrying someone. You're going to marry someone, meet that person, see his or her likes and dislikes, do a background check. It is important for both men and women. है ना? We are going to spend your life with someone. In case you want to do it, or ask the person directly about it. But once you take a call that this is the person I'm going to live my life with, do not doubt again, and give your best shot. Life will be kind to you in your personal life. Life will be kind to you in your professional life. End of the day, you are sincere, karma always comes back and rewards you more than what you have wanted. There are people who are frustrated in pediatrics. There are people who are frustrated in uh, radiology, dermatology, medicine, surgery, neurosurgery, uh, critical care, all places. And there are people who are satisfied even with MBBS, people who are satisfied even being Ayurvedic or homeopathic doctor and doing excellent in life. Self satisfaction is a relative thing. Don't go by what others are saying, and don't be under the illusion that I will come out of MD pediatrics or DNB pediatrics, I will earn money like this. It will not come like that. You will have to start from scratch. But the effort you have done in 3 years will decide how fast you get settled in life, and you will get settled if you have been sincere student. So that's all I want to share with you. And all of you, I'm really sorry. With folded hands, I ask for apologies if I have missed replying to some of the messages. You can ask me again. Some of the information I don't have access to, even if I have done my homework last 2 3 days before I came for this live session. And in case I have offended somebody in some way, again I apologize for that as well. But end of the day, it's your life, and I know you are going to be excellent pediatrician. So once you join pediatrics, do let me know what branch did you join, and maybe some year later we run into each other as fellow pediatricians. All the best. Stay in touch. Stay in touch. रेजिडेंसी में जब टॉपिक नहीं मिलेगा या वो नहीं मिलेगा, so my students still call me up and still ask for me कि सर हिनारी से नहीं मिल रहा है या स्काई हब से डाउनलोड नहीं हो रहा है, हाउ टू फाइंड दैट आर्टिकल. देयर आर कैच थिंग्स, देयर आर tips for that we will discuss some other day once you are a resident. Bye bye. All the best for your life. God bless everyone, and live life. सिर्फ academic नहीं. Once you're out of your department, try to develop your hobbies. First 6 months सबके लिए मुश्किल होता है. Develop your hobbies. You like painting, you like listening, you like chatting. Do that, but don't become totally a bookworm. You stay balanced. You will not get frustrated in life. Bye.